even comb or to wear your dress. Imagine needing support to do all these small day-to-day activities. Many of us suffer from a condition called adhesive capsulitis or frozen shoulder. You must have heard your relatives or anybody suffering from this disease. And this is a very debilitating disorder where it can affect your day to day activities. Good evening, everyone. I'm Dr. Vikram Jain, and we are live on Optima Facebook. Live today, our monthly meeting on common disorders for patient awareness. And today, to discuss about this topic of frozen shoulder or adhesive capsulitis, we have with us Dr. Shivraj, an esteemed physiotherapist. Welcome, Dr. Shivraj.
Good evening, everyone. So today we are meeting and discussing one very common problem everybody facing, which is frozen shoulder. So yeah, we'll throw some insights which will be very useful for your daily routine, which like whoever is suffering from it. So yeah, we'll start. So
Great. So recently, Dr. Shivraj, my uncle came to me with pain in his shoulders. And when I examined him, he was unable to lift his shoulder. He needed help up from his son to wear his shirt also. And then we later realized that this is frozen shoulder adhesive capsulitis. Obviously, India being the diabetic capital of the world, a lot of people have diabetes, and one of the common causes was frozen shoulder is diabetes. But can you just let us, our audience, know what causes this frozen shoulder and what are the mechanisms?
yes, sir. So basically, frozen shoulder is characterized by stiffness, lot of pain, and limited range of motion, which is creating a lot of difficulties in our daily life. So basically, frozen shoulder is mainly have multiple causes. So basically, it is idiopathic. Nobody can tell why it is happening, but there are some associated factors which can leads or increase chances to leads this kind of changes or adhesive capsulitis or frozen shoulder. So few of them are like diabetes, around 70-80% of cases of frozen shoulder may be having diabetes or some thyroid related issues. Second factor is age. So most of the time 40 to 60 years of age is the target population where the frozen shoulder commonly happens. It like in early ages it's very unlike, like if you have associated any trauma or any other post traumatic stiffness kind of stuff, then it might appear in early ages, but it's very less likely. Then like this is the main two reason, like diabetes as well as age. Third thing is like females are little more affected compared to males in frozen shoulder kind of conditions, and sometimes it may occur in one side. In very few cases, around 10-15% cases, it can affect both the shoulders at a time, or sometimes one shoulder, and after one shoulder is started recovering, or you know second shoulder also might get affected, but it is very less likely. Around 8 to 10% cases might have this kind of incidences. So yeah, this all we can count as a causes of the frozen shoulder in normal
Yeah,
population.
interesting, Dr. Shivraj, because just remembered my one of my relative had a accident and was prescribed to be on a cast for quite some time, and then
Mhm.
after that, I'm not sure what happened, whether the physiotherapy was not done properly, and now he's not able to lift his hand, though there's no fracture in the shoulder. And now I look back and say probably he had frozen shoulder. Is that right? Could this be one reason that prolonged immobilization has also?
Yes, yes, definitely. That is also we can count associated factor. So if your rehabilitation is affected, like if you are immobile because of some trauma or fracture, and you are not done with your rehabilitation properly, your stiffness is still there, then in that time, or later in your life, you might have some higher chances to get frozen shoulder, because one of the associated fracture is definitely some immobilization, prolonged immobilization, or half rehab done, or some traumas. Yeah.
So just to summarize, causes you said most commonly diabetes, hypothyroidism. There can be autoimmune causes, post-operative immobilization or prolonged
Yes.
immobilization, and sometimes idiopathic also. Now, we understood what could be the causes, and usually you said it affects women more than men. Um,
Yes.
what could how do we manage this if somebody has frozen shoulder? What do they do? How do you even before management? How do we really diagnose this condition? How does one say
Yeah.
okay, you have
So
frozen shoulder and not some other problem?
yes, definitely. So frozen shoulder have particular characteristics. So frozen shoulder always associates with lot of pain. So that pain will be limiting your night sleep. You will have a lot of sleep disturbances. So basically, we'll divide frozen shoulder in three stages. So according to that, it will be very easy to diagnose at home. Like if you are having any like shoulder related things, you can easily diagnose whether it is frozen shoulder or you have to go for any other checkups or any other things. So first, like frozen shoulder is always associated with a lot of pain first, which is first stage, which is freezing stage, where your joint is getting lot of pain because of some changes is happening at the capsular stage or some joint related area. And second stage, which is frozen stage, where you will get lot of stiffness. So pain is starting, but because of pain, you'll stop moving your joint too much, and eventually you'll start getting stiffness. So that is called frozen stage. And third stage, which is little thawing stage, we can call. So it is almost little recovery kind of phase where your pain starts reducing and little bit of stiffness also reduces, and you will get some of relief. But that is very long. It can take up to 9 months to up to 2 years to get recover from the same. So this condition have particular symptoms. If you have other differential diagnosis, we can call other conditions like rotator cuff injury or some impingement syndrome. So in those kind of activities, frozen shoulder have one characteristic which is always have some range restriction. So if you have more than 50% of your range restricted, that is also in particularly two movements, which is abduction, which is side lifting your arm, and taking back, like behind the back, which is called some external rotation movements. So these two movements will be mainly affected in frozen shoulder. But in other conditions, if you see rotator cuff injury or some impingement syndrome or some post-traumatic stiffness, these characteristics will be not associated. So stiffness as well as lot of range restriction, night pain, and sometime what happens, because capsule is too tight, it can restrict, as I told, particularly two movements, which is external rotation and abduction of the shoulder. So we can easily differentiate in multiple ways that this is the frozen shoulder.
Okay, so it is more of a clinical diagnosis. You don't need a specialized imaging or a blood test to say it is frozen shoulder, right?
Yes, yes, yes.
So, just for the benefit of our viewers also, I'll just reiterate what Dr. Shivraj told in Hindi. तो कंधे का मूवमेंट जब रेस्ट्रिक्ट हो जाता है, फ्रोजन शोल्डर बोलते हैं हम उसमें, तो बहुत सारे कारण हैं उसमें, एक डायबिटीज़, थायराइड, ऑटो इम्यून डिजीज़, ऑपरेशन के बाद ऐसे कारण होते हैं जहाँ पे बेसिकली कंधे का मूवमेंट रेस्ट्रिक्शन होता है, ऊपर उठाने में और घुमाने में तकलीफ होता है, और बहुत यूजुअली महिलाओं में ज़्यादा होता है, मिडिल एज में ज़्यादा होता है, यंगर एज में होने का चांसेस कम है. Now moving forward, Dr. Shivraj, so we know what are the causes, we understood what are the symptoms people can identify, and how does one manage this condition? Is it can it be done at home? Do you need to meet a specialist? And what is the steps in getting this evaluated and treated?
Yes. So, long story short, there is as I mentioned before, there are total three stages. So, in which stage patient comes to you and which kind of complaints they are having, accordingly, the recovery or recovery time depends, and as well as management, how we'll manage. So different stage always have some different management. So if patient is coming initially, so it is little sudden like gradual onset, it is not sudden onset where you suddenly start getting that much of pain. So it is slowly uh, pain is getting worse day by day. Slowly you'll start getting sleep disturbances and difficulty in daily activities because of pain. So day by day you'll start limiting yourself with that much of movement because of pain, and eventually you'll start getting second stage, which is freezing stage, where your shoulder is getting a lot of stiffness because you are not doing much movements. So if patient is coming in initial stage where a lot of pain is there, then we directly cannot start with some vigorous movements or any physiotherapy where lot of pain is associated. So we can't stretch or we cannot give certain vigorous exercises. So best thing we can do is we have to start activating surrounding muscles, as well as we can advise them to go with some steroid injection or like corticosteroid injections, which will definitely help them to reduce the pain. And steroid injection can work for several weeks, so it will give us time to work on particular muscles to improve the strength, as well as work on the range of motions, because patient is not having that much of pain where it is intolerable and do certain exercises or activities. Second stage is frozen stage, where if patient is coming with severely restricted range of motions, then definitely we can help them with multiple manual therapies or soft tissue release techniques and lot of exercises, which will definitely help them to regain their range of motion, as well as, because in that stage pain will be there, but it will be not that much where it used to be in the freezing stage. It will be there, but more of stiffness will be there, limiting your daily activities because of restricted range. So basically we have to improve their functional activities, all the functional activities where they are, as you mentioned, combing, dressing, and all these activities should be little easy. So for that we can give so many exercises and manual therapies, as well as soft tissue mobilization and things. And third stage is thawing stage, which is very long term stage. But there also you have, so if you are having frozen shoulder, early intervention is always giving you faster recovery. So more early you get to know that you have a lot of shoulder pain, you should go to doctor and see a doctor. Then doctor definitely give you a lot of advices. You have to take physiotherapy, do this kind of medications, which will help. But most of the patients are in negligence, that it will come down, or taking some painkillers things and all these things. But those kind of things will not help in long run, because it is associated with lot of fibrosis of your joint capsule. So that will not reduce with painkillers and stuff. So you have to go for some long term relief. So there we can definitely help them.
So as you said, the treatment depends on the stage of the frozen shoulder. So if it's the first stage
Yes.
of the painful stage, we would help with steroid injection and maybe mobilization. And in certain stage where it is more of fibrosis stage, where you can do some minor therapy and mobilization. Now, you initially told me that this can last long. So how long can average recovery can be expected in a patient with frozen shoulder?
So frozen shoulder is a like very long journey. More early you get diagnosed, more early you will get recover. So this all stages which I mentioned, that can last longer from 6 months to up to 2 3 years also. It depends on the severity associated. Like as we mentioned, if you have diabetes or multiple things associated, then it will take longer time to recover. But usually it takes around 6 months up to 2 3 years also in some cases to recover completely 100%. But this is self-limiting, but it is completely recoverable thing. You will get almost near to 100% recovery in that time span, around 6 to 2 years, as I mentioned.
There is a question I just want to add here by Mahesh. He asked, what are the potential complications of untreated and unaddressed frozen shoulder? So you said recovery usually 100% by 6 months to 2 years. But if somebody does not take any treatment, just leaves it like that, will it recover? Or after intervention only we expect improvement?
So, as I mentioned, thawing stage, which is called recovery stage, that can take up to 2 years, 3 years sometimes to recover you from that freezing stage. But in those cases also, you will definitely get around 90-95% of recovery. But some cases have a lot of stiffness associated, or some severe muscle wasting is happened because of prolonged unused muscle or unused joint. So that can lead arthritic changes or some wasting kind of muscle wasting, which is very severe in nature. So from there to recover automatically without doing any interventions, it will be a little difficult. But definitely you will get recovery without doing any intervention also. But it will be associated with some uh, complications.
Okay, so obviously, if untreated, there will be a lot of muscle wasting, and that may lead to delayed improvement and a lot of complications. Now, I'm here sitting on the desk, our audience sitting and watching. What can they see to assess whether they have frozen shoulder? What simple maneuvers can you show us to say, okay, I may be having frozen shoulder, I may need to see a physiotherapist? What because most of us are sitting on the desk whole day with the hands around, maybe inside like this, and maybe our movements are not so good. I realized that when I started to do some bowling and all, I was finding it very difficult, and then I realized that my maybe movement is not so good. Can you do tell us some few things just sitting in front of the system? Can we just say, okay, this movement is not good,
Yes.
maybe I think I may be having frozen shoulder? What our audience can just by simple a few assessment on their own, which they may lead them to think, okay, they may be having frozen shoulder and maybe they need to see a doctor.
Yes, yes. So as you mentioned, like sometime if you feel difficulty in bowling kind of actions and all these things, in those cases, frozen shoulder won't be, that much. We should not do. So frozen shoulder have particular characteristics where you will get particular movements which get affected. So it is basically adhesive capsulitis. So where your capsule of the joint, which is surrounding covering of your joint, which is getting little stiff. So there is one particular pattern of your capsule where your joint moves usually. So shoulder joint have one particular capsular pattern, which is abduction and external rotation. So if your capsule is become lot of tight, then these two movements will be the first movements which get affects. Along with that, there will be definitely some other movements will be affected. But these two movements which give you idea that this will be around 90 to 100% accuracy telling that this might be the frozen shoulder. So first is like lifting your hand sideways. So if you are limiting yourself lifting somewhere around 90 degrees or more than that, so frozen shoulder always get diagnosed when your joint range of motions are restricted more than 50%. Okay. So as you mentioned, you are feeling some difficulty in bowling. In those kind of cases, you might have some impingement also. So impingement, which is supraspinatus muscle, when muscle is crossing the shoulder joint. So if your posture is bad, or if you have some weakness in your muscles, then that muscle can impinge, and it can give you sharp pain at the, as I told, abduction 90-degree, but it will be not associated with stiffness. So if you have any muscular injury, you will have some. So there is one end feel we check in physiotherapy, where end feel is a measurement of your like joint, how it reacts. So we'll check it passively. So if we are lifting your joint and if we'll feel if it is soft tissue injury, it can further go. So basically, it will differentiate active movement and passive movement. So patient can easily do active movements up to 90-degree, but passively it can go up to full if impeachment is there. But if patient is having frozen shoulder, uh, active as well as passive, both the movements will be associated with the pain as well as limitations. So active means patient is doing by itself, passive where physiotherapist asks them to do some movements to take them in the full range of motion. But in frozen shoulder, it will be very difficult to do with passive movements also. So that's how we can differentiate whether it is any soft tissue related injury or it is definitely frozen shoulder. or we have to go to see any physician for help.
So sitting in the desk, maybe we can ask them to do abduction and maybe external rotation.
External rotation, yeah, that is the second movement. So external rotation is, so this is called internal rotation where shoulder moves inward, and external rotation where your shoulder can go more than that, upwards, like that is called external rotation. So this external rotation will also get affected. So from here you won't be able to lift further. Around 5-10 degree you will have movements, but not up to 90 degrees. So 90 degrees is the normal range of motion of your external rotation. So in frozen shoulder it will get severely affected. You might have some 5-10 degrees, or somewhere around 15-20 degrees also if you have little milder frozen shoulder, or some stage wise depends.
Fine, perfect, Dr. Shiva. That is so very helpful. I think all our audience also can try it. Maybe try to move their hands abducted and try to see this external rotation and see if there's any limitation, and probably look for causes like frozen shoulder. So
Yes.
moving ahead, we have a few questions I would like to take up. We have another 5-7 minutes left. Chacha is asking, how does diabetes impact the development of treatment of frozen shoulder? So I would just like to take this up that diabetes can cause something called as glycation, and where the soft tissues get deposited with glycation end products. So it can cause things like frozen shoulder or trigger finger, etc., and carpal tunnel syndrome, where because of uncontrolled diabetes, the glucose end products get deposited into the soft tissues. Now, how does impact the treatment? Probably apart from what Dr. Shivraj discussed, we also use certain medications to help control the diabetes well. That is the most important. Controlling diabetes is most important, as well as what the rest Dr. Shivraj explained about the exercise and injection, etc. So, second question by Mega, she's asking, can frozen shoulder affect people who are healthy and active too? Is it possible people who are healthy, active, they can also be
Yes,
affected
yes,
with
yes.
frozen shoulder?
So yeah, frozen shoulder, as we mentioned, it is very idiopathic. So nobody actually know what is happening in the shoulder. It can affect, as we mentioned, age group 40 to 60. If they are healthy enough, they are active enough in their lifestyle also, it might get affected at any point of time, because the process of that, involving your capsule and forming that adhesion and making it freeze, or some fibrosis, like fibrolysis, so many things are happening. There is no particular reason why it happens. So associated factors definitely add into that, but definitely if you are active enough,
Yeah,
then also you might get
possible. I
affected.
mean, I agree. As I said initially, also my uncle I was talking about, who had frozen shoulder. He didn't have diabetes, didn't have hypothyroidism. There was
Yes,
no trauma, absolutely no cause, but frozen shoulder. So it can happen rarely. Idiopathic. Idiopathic means we don't know the cause. Now, Pramila is asking, how does a treatment offer in different stage? I think we already discussed that. A question from Bhairavi: does frozen shoulder affect sleep time, and how can we manage pain in the night time?
yes. So night sleep is one of the frustrating thing which frozen shoulder patients come with. Their main complaint is like they're having a lot of difficulty in their functional activities, as well as they are not able to sleep on that side. So
Hmm.
sometimes if affected shoulder, where sleep habits are particular, sometimes patients are sleeping in a particular position. If they are affected with that same side of shoulder, most of the patients will have similar things where they are sleeping on the same side, and that side only get affected with the frozen shoulder. So if you are suddenly turning, because that frozen shoulder is very painful stage, if you are moving your joint where your range is restricted and capsule is very tight, if you suddenly move your in your sleep, then it will give you sharp shooting pain, and it will definitely affect your sleeping hours. So you will be lack of sleep in like so many things associated with that. Irritability will increase, it will hamper your daily activities, and you'll get a lot of frustration because of that. Yeah. So
Sure. Dr. Shivraj, we will just shoot some frequently asked questions about frozen shoulder, and you need to give us quick
yes,
answers.
yes.
We have a short time left. Can frozen shoulder go away on its own? A quick short answer in one sentence.
Yes, it definitely can go, but can take a longer time.
Are steroids safe to you be used in frozen shoulder?
It's not safer to use for multiple times, but single dose can give you faster recovery and better prognosis.
Good. How long does recovery take?
It depends on the stage and affection, how many associated factors is there. So it can take up to 4 to 6 months, up to 2 3 years. Also depends.
So patients need to remember they have to be patient. It can take time. It can take 6 months or up to 2 years. So it cannot be fast forwarded. It has to go through the various phases for it to recover. So please be patient. If you have frozen shoulder, it will recover, but you have to continue your rehab. Can I continue daily activities when I have frozen shoulder?
So if you are in painful stage, you should be avoided overhead activities or sudden jerky movements, which can leads to a lot of pain and some other complications in your frozen shoulder. Okay.
Perfect. Dr. Shivraj, can you give us few take-home advices to our viewers if they have frozen shoulder, if they're suffering from frozen shoulder, do's, don'ts, few take-home messages.
Yeah, so if you are not having frozen shoulder, be active. Use your all this available exercises, which is you can nowadays very easy to get particular exercise programs to maintain your mobility or maintain your muscle strength. So keep maintaining your muscle strength and mobilities. It will help you to recover faster. So if you get frozen shoulder by very rare cases, but if you get that also, it will be very easy to come out of that because you already have some muscle strength as well as some mobility in that. But in that later stage also, where I mentioned different stages, later stages of your frozen shoulder also, it will definitely help. So keep moving, keep be mobile, do regular exercises, be fit enough. And yes, there are lot of exercises you'll easily get nowadays from anywhere. So keep moving, be safe and be healthy.
Thank you, Shivraj. One last question. Somebody with frozen shoulder comes to you, a physio. What is the average sort of rehab program you are looking at? How frequently? How long? Or it is very individualized, cannot be really generalized.
Yes, yes. So physiotherapy and rehabilitation can make huge difference in your recovery times and recovery periods. In our daily practices, we are practicing from last 6 7 years, and we are seeing multiple thousands of cases still now of frozen shoulder because is nowadays very common because of diabetes and a lot of lifestyle things here and there. So we can expect if you are taking regular physiotherapy and rehabilitation within 12 to around 16 to 18 weeks, you can definitely get around 90 95 or sometime 100% of recovery with the helps of so many techniques. Advanced techniques are there. Physiotherapy is evolving day by day. You will get a lot of new techniques which is hands on and give you quick recovery. Physiotherapy is not just exercise. You should definitely explore few other aspects of physiotherapy where you'll definitely get some miracle uh, results from the so mobilization definitely helps you regain your range of motions very quickly. Within few weeks you will feel amazing results, and your recovery time will be much shorter by as I mentioned, 2 3 to 4 months you will be almost near to the recovery, which is
Perfect.
yeah.
Sure, Dr. Shivraj. You want to add something?
So which is without rehabilitation or exercise, it might get stretched along and you will have a lot of complications later on that also. So that will include around 2 3 years of recovery time with the complication. So if you are aware enough with the physiotherapy and rehabilitation, definitely you can ask. Here's also question. We are available in social media Optima Hospital, so from there also you can put in comments or you can directly DM us. There is number, you can directly contact us, how we can help you, how to you know so those inquiries And mainly education is one of the most important part of the treatment. So definitely you should get educate enough yourself from any kind of this condition which is affecting you in your daily life. So be educated and keep moving.
Thank you, Dr. Sivraj. Thank you for taking time, and hope you guys enjoyed our conversation today about frozen shoulder. Just sum it up: frozen shoulder is not so uncommon. Common usual causes are diabetes, hypothyroidism, can affect your day-to-day activities. Diagnosis is mainly clinical assessment, and there is treatment available. There is very good treatment available, and with almost complete recovery in most patients. So do not delay. Consult the doctor today if you have this problem to help you deal with this condition. So with this, we end our program today. We are crossing our time and hope to meet you soon with similar programs and similar topics. And if you have any queries, please put it in our chat box. We will definitely take it up with Dr. Shivraj and get it answered. Thank you all. Thank you once again, Dr. Shivraj. Good night.
Thank you, Vikram sir. We'll see you next session with more fun and more different topics to help you in your daily lives. Thank
Thank
you
you.
all.
Thank
Good
you.
night.
Bye bye.